That is the outside bump of your ankle that you can feel. And of course, that also helps make up the talocrural joint here and here. This is the talus, this big bone right here. And I don't think y'all need to go over that. I think you got that. Oh, I think it did. It does have two joints with the tibia. Of course, here where they articulate, that would be the what?
Proximal.
Tibiofibular joint. This would be the
Distal tibiofibular joint.
Okay. I'll get your joints down.
Yes, I think. Try to say it backwards this time.
Soda. Oh, UE. No.
We're slowly moving.
Moving on to the foot.
I mean, like,
Me soda. Oh,
Hey,
UE.
we're almost
Okay.
at the bottom of the body.
Yeah. So how many bones are in your lower extremity?
oh.
Let's count.
1, 2, 3, 4, 29,
The
30.
hips
4
and stuff
plus
again.
30.
24.
So 58.
So
4
30.
plus
30.
26.
26. 30.
Okay. You can name them probably, right?
Well, not
foot.
the
All the
foot.
tars-
You will. You will. We'll talk about this.
That is.
So just in the
Right,
foot,
you
you
have
have
to, like, with the
26
wrist
bones.
tarsals.
Okay? You have the ankle, which is made up of 7 tarsals. You have the body, which is made up of the 5 metatarsals, and you have the toes, or the 14 phalanges. Right? So what are these?
The metatarsals.
Phalanges.
Oh, the
Phalanges.
phalanges. I thought you were
What are
pronouncing.
these?
The
The
metatarsals.
metatarsals.
And what are
The
the
tarsals.
tarsals? The tarsals. Okay. That's one thing you need to do is to learn the bones of the wrist, the carpals, okay? All right, so your talus, that is the second largest
Those are
foot
the
bone. Anybody know what the largest is?
Yeah, the first
Your
one.
heel
Uh,
bone?
Like you did.
Your heel bone?
Your heel bone, yeah,
So long.
the calcaneus.
Here comes
Okay, so the talus with which the fibula and the tibia articulate is your second largest foot bone. It's the only one that articulates with the bones of the lower leg. And then it takes that weight from the whole body and then transfers it to the next bone, the calcaneus, or your heel bone. And can y'all see from this angle, maybe better from this angle?
It's a funny looking bone.
So here is the talus, this big bone here is the calcaneus. It's got to be super strong because it is taking all of your weight, and then the next thing is transferring it to the ground. So the calcaneus or the heel bone is the largest tarsal. It's located, of course, right below the talus, right below that joint, and it does support all your body weight. Next, you have your navicular and your cuboid. And let me get you a picture of that. I always remember it, North Carolina. Okay? This is a little easier. Okay, so you have your what?
Phalanges. Your metatarsals.
Metatarsals, okay?
Tarsals.
Okay. So we have, okay, we're gonna start here. So we have your talus, remember what articulates here?
The
Fibula,
fibula and tibia.
tibia.
This is your,
Calcaneus.
okay, which is also commonly known as your
Heel bone.
heel bone. Okay, good. So then if you move forward, we have the navicular and the cuboid. And I always, like, I look down, on my right-hand side, I'm thinking North Carolina. And I don't know why I do that, but it helps me remember. So this is navicular, this is cuboid. And then you'll have 3 right here together, that they're called the cuneiforms. So what do you think that one is called? It's more what?
Medial.
So you have the medial cuneiform, then you have one in the middle, intermediate, then you have the lateral cuneiform, okay? Yeah.
This is gonna be a lot more easy than the hand, my opinion.
I feel like the arm was kind of stressful.
Yeah.
Arm was a little stressful.
The leg already seems easier.
And the leg is definitely.
Alright, so guys, you have your tarsals, remember they make up the body of the foot, and they're just like your, metacarpals, they are number 1 through 5. Number 1 being your what?
The house.
What is the
big toe.
house?
Big
The
toe.
big toe. And of course, what would number 5 be?
Your pinky toe.
Your pinky toe. Okay.
Detail.
So the arches, which are really, really important, of your foot are between the heel bone, the calcaneus, and the ball of the foot, which are your distal heads of the metatarsals. So from the calcaneus, you're touching the ground here to here. Can y'all see that there's like an arch right here? Form? Now in architecture, arches are like a big deal.
Pinnacle.
They actually help, strengthen a structure, and you'll see it all throughout history, arches and architecture. So this arch that's in your foot is extremely important. It has three main functions. It's going to distribute your weight between the calcaneus or the heel and the metatarsals. They're going to provide lift when you're walking or running or anything like that. And they also will absorb shock when you're walking or running or standing. So what happens if you don't have this arch?
You have
You're
flat
probably
feet.
not as strong. Like,
You have flat
probably
feet
easier.
and what? So
Not
if you
fast.
don't have
Weaker.
lift and shock absorption, how are you gonna feel?
Pain. Hurt.
Painful,
Probably hurt to walk and run.
hurts to walk and run, and especially you don't wanna stand for very long, you don't wanna walk or run for very long, because your lower back is really going to absorb all the shock that normally the arches are absorbing. You don't have that weight distribution, so your feet hurt. And who knows, does that affect anyone, having flat feet? Have you heard anything about that?
Mm-mm.
You cannot join the
Army.
military.
Dang.
You can't join the military.
Because you have flat feet.
'Cause you
Um,
gotta run.
You can't
One of
run
the things that they do is they have 20-mile marches, or 50-mile marches or whatever.
Yeah.
And can you imagine having flat feet and having to march for that long, in pain? So if you're flat-footed, they really don't want you to join the military. What happens is, remember, you have ligaments attaching bone to bone. So these ligaments oftentimes have collapsed, or they're too loose and they don't support the arch shape. And like I said, because you don't have that shock absorption, usually that lower back is going to really absorb that, and you wind up with a really bad lower back pain when you have flat feet.
What causes those ligaments to collapse? Like overdoing it, or can you be born with that?
You can be born like that, yeah. It just, a lot of times you just have what they call weak ligaments, or typically they might be a little longer, and they don't need the support that you normally need. So this shows you what a normal arch should look like, and of course you can see the flat foot here. So your phalanges, how many do we have?
14.
14. Tell me what they are, Maddie.
The 14?
Mm-hmm.
Like,
Your distal, your
How
Oh.
number one?
proximal.
So these are
Oh, you
your,
you mean your, like, your distal?
okay, so how many do we have?
5.
Middle?
You have 4.
Oh.
Or, I mean, no, you have 5, and then you have,
No, wait, you're right.
no, it
We
was
have
5,
four
and then you
middle.
have
Believe in
4,
yourself.
you have 4 proximal ones.
No, 5 proximal, 4 middle. The
Five
thumb has a
proximal, four
distal and
middle.
proximal. The thumb doesn't have middle.
Oh, okay.
Yeah, remember the thumb only
It has
has,
just
distal
the
and
distal and
proximal.
proximal.
right, okay. Just trying to,
Because you can't have a medial without a distal
job,
and
Mary.
proximal.
okay, which takes us to joints.
Oh,
Yay!
golf.
Ooh, okay.
Look at us go.
Okay, we did it.
So your joint, by definition, is a point of contact between, and it can be several different situations. Bone to bone, that's one type of joint. We've talked about a lot of those, haven't we?
Mm-hmm.
Cartilage and bone. So, where do we have cartilage and bone meeting in our body?
Do you have a joint in your nose?
Cartilage?
Oh,
Your
wait,
rib
joint in your nose.
cage.
Right.
Okay, your ribs.
You know, she said where the
Backwards.
cartilage and bone in your
Yeah,
body.
so
And
this
your
is bone and
spine.
cartilage,
And
so
your
this is
spine.
actually
Your
a
spine.
type of joint,
Your spine and your pubis symphysis
and your spine, your pubic symphysis.
Good.
And another
What?
one,
is your height.
Watch
No.
what she's about to say.
She better
Is
take
what?
the head off.
No, wait, no, your teeth.
your teeth. So where your teeth are embedded in bone, that's actually a different type of joint in itself, okay?
I was just listening to ideas.
So where are the three
It is
types
very
of joints? Where are they?
Your bones.
Between
Bone to bone.
Cartilage and
Between
Cartilage to
cartilage and
bone.
bones, and between teeth and bones.
Good, okay. All right, so your joint structure, like in chapter 1, will determine its function, right?
Right.
So what do we know about this type of joint?
It can
Ball and
rotate a
socket.
lot.
It allows rotation.
Okay.
And
And-
free movement.
Abduction, yeah, so basically any movement is pretty much possible with this joint and this joint, your ball and socket. Okay, what about this joint?
It's not movement at all, or just like a little bit.
Very little,
Very little movement.
very little movement. So we're gonna talk about, what types of joints will allow what types of actions. Another really important one too is, what's this one called?
Your TMJ.
TMJ, what does that mean?
Temporal mandibular joint.
Okay, do you think it has a lot of motion?
It needs.
Yes.
It needs to, but what did I say about the joints that have a lot of motion though?
They are very easy to dislocate.
They are very easily dislocated, so it's not unusual to get your TMJ dislocated. When that happens, you're probably looking at some
Surgery.
really long issues, yes. So the movements of a joint are gonna be determined by several different
Crickets.
things. First off, how closely the two structures meet, how close their fit is. If you have a very, very, very tight fit, can you think of something like that? A very, very tight
Your
fit?
sutures.
Sutures, do they move?
Mm-mm.
Okay, so the tighter the fit, the less motion you're gonna have, and that's really handy in a lot of different joints, right? Shape of the articulating bones, and we'll show you that, especially when we talk about our, synovial joints. Then the flexibility of the connective tissue, whether it be ligaments or tendons or, whatever's holding it. The position of those tendons and ligaments and muscles. And then lastly, we're gonna talk about how a particular hormone, actually we've already talked about this hormone, can affect the joint and loosen that joint. Remember relaxin?
Yes.
Yes? What is relaxin, when is it secreted?
Like whenever
During
you're
labor.
pregnant.
Or before labor.
Or before labor, sorry.
So late stages of pregnancy, it could be a few weeks before delivery, you start noticing that, it doesn't feel
Feels like everything's
good.
falling out.
Yes,
Yeah,
Yes.
literally feel like everything's falling out.
Falling
Very good. Alright, so joint classification can be a couple different formats. Let's talk first about structural classification. Okay, structural classification is based on a couple different things. One, whether or not there's a joint cavity. Okay. Secondly, what type of connective tissue is holding that joint together. Okay. So structural, is there a joint cavity? Or secondly, what type of connective tissue is holding the bones together? So different types of structural classifications, you have a fibrous joint. Fibrous joints have no joint cavity. They also have bones that are held together by dense, fibrous connective tissue. Can you give me an example of that?
One that tells us an infant.
Yeah, I'm thinking answer, but I can't think
Sutures.
Sutures.
Sutures, okay. A cartilaginous joint, guess what?
Cartilage.
Cartilage.
Okay. Again, no joint cavity. The bones are held together by cartilage, usually hyaline cartilage or fibrocartilage. Give me an example.
Your knee.
Wrong.
Because
Think-
it's got areolar.
Think about where you see like maybe a bone, cartilage, a bone. Your vertebral column, good. Can you think of one we talked about?
Symphysis.
Yes, pubic symphysis. Okay, so those are both are fibrocartilage, and those are examples of a cartilaginous joint. Now, synovial joints, we're going to talk extensively about these. Okay, you do have a joint cavity present. You've heard of synovial cavity. Okay, synovial joint. You have bones held together by an articular capsule. We're going to talk about what composes articular capsule. Typically it's like ligaments and tendons, and you might have muscles, and then you have some other structures too that you'll need to be familiar with. Now, synovial joints are usually classified according to the shape of the parts of the bones and the movements they allow. So, what did I say this type of joint's called? Ball and socket. The ball would be the
Head.
head, and the socket would be the,
Also.
okay. the glenoid fossa, okay? So that was structural classification. Now we also have functional classification. Functional classification is basically to what degree can they allow movement. We have the synarthrosis, meaning together, amphiarthrosis, and diarthrosis. So the synarthrosis, meaning together, arthro meaning joint, you have very little, if any, movement between the joints and includes immovable joints. And what would that be called?
Suture.
A suture, okay? So most synarthroses are fibrous joints, which means you have that dense fibrous connective tissue holding it together. It's very, very tough, very hard to separate. The three types of synarthroses, your suture. Okay, we know what that is, right? Number two, I had a student one time that said if they had a son, they were gonna name him agumphosis, or name him gumphosis. So gumphosis, anybody wanna take a guess where that is? Your teeth. Your teeth in the what?
Alveolar processes.
Yes. Okay. So that is a gumphosis. Hopefully your teeth don't move a whole lot, right? Then you have a synchondrosis. Together, what?
Together.
Cartilage. Okay. So held together with cartilage. So a suture is a great fibrous joint that you'll see between the bones of the skull. Dense fibrous connective tissue. You would basically have to crush the bone to be able to get any movement going on here. This irregularity in the way the bones fit together actually add much stability to it and hopefully a decreased chance of injury and fracture to those bones. The gumphosis. Okay, this is where you have a cone-shaped peg, which would be what?
Like your teeth.
The what?
The roots of your teeth.
The roots of your teeth fitting into a socket, which would be your alveolar processes. And now remember, your teeth are held by ligaments, and they're called periodontal, being around the tooth, ligaments. The only example you have of a gumphosis is actually the roots of your teeth, fitting into those alveolar arches of both your mandible and your maxilla. A synchondrosis, syn meaning together, chondra meaning cartilage. So you have hyaline cartilage connecting this joint. Typically, it is not considered to be a permanent joint because what do you think eventually is going to happen to the cartilage?
Ossify.
It will ossify, be replaced by bone. Okay. Some examples of this. I know y'all heard of the epiphyseal plate. What does it start out as? Epiphyseal plate.
Yeah, and then goes to a line.
It starts out with hyaline cartilage. Remember the bone template, you have at either end of a long bone, you have this hyaline cartilage left. And over time, as you grow, and eventually the bone growth catches up with the cartilage growth, it will overtake that and turn into bone. You have the epiphyseal line left. The cartilaginous connection between the sternum and the first vertebrosternal rib, this very quickly will turn into bone. So we're talking about this area right here. And as you get older, these all will ossify. So that when you use CPR, what do you think is going to happen with a really old person?
They
Ribs are going to
break.
break because you've lost this flexibility of the cartilage. And when you press on it, you might hear cracking. So should we stop?
No.
Break the ribs? Right. Never
They are
stop.
actively dying.
Don't stop CPR.
Okay.
Then how come his coccyx is fused if he still has cartilage up there? Your bone is, your skeleton is.
I'm gonna